The race between vaccines and variants is at a critical point. The modeling prediction from 2 weeks ago that forecasts a resurgence is playing out in the data we are seeing now, with case counts plotting along the strong resurgence trajectory. It is clear that we need stronger control to combat variants of concern that are driving rapid epidemic growth in many areas of the country.
Canada's COVID curve is in a near worst-case scenario as outlined by public health modeling data. Dr. Theresa Tam says stronger, stricter controls are needed to stop the spread, particularly for variants of concern, but she wasn't able to offer specific guidance.
It was really reducing contacts, which may mean also reducing mobility and essentially mixing. And so we have seen a number of provinces stepping up the measures just in the last days, including where I'm sitting, Ontario. That is really critical. So, the messages being sent out is right now in the Ontario setting, for example, is try to stay at home as much as possible.
Throughout the pandemic, federal health officials have said the provinces are best suited to deciding what health restrictions are appropriate. But the growth of COVID in Canada is quickly accelerating. B117 has now reached 25,000 cases in 5 months, growing at the same rate as the original virus. But B117's growth comes after Canadians have already learned to socially distance, wash hands, and deal with life in lockdown, underlining the deadly nature of this variant. The PM himself ruled out once again any possibility of the federal government stepping in.
I think we're all recognizing that we don't want to be in this third wave, but we're here. And as we've been doing from the very beginning, we've been working very closely with the provinces and territories to ensure that they have the supports necessary to make the right decisions for their jurisdictions.
Dr. Tam noted that data always lags behind real-world conditions, needing around 2 weeks before models will reflect what's happening on the ground. This means our current crisis doesn't even reflect spread that may have happened over the Easter long weekend. Public Health was also not able to outline what percentage of Canadians need to be vaccinated to reach herd immunity. The United Kingdom says it's reached herd immunity with 70% of people vaccinated, but Dr. Tam says Canada just doesn't have data on how vaccines affect transmission.
There are some early signals, particularly I've seen certainly with the mRNA vaccine. We need more data from the AstraZeneca vaccine, but the sort of pointing towards people having a reduced viral load, for example, in the back of your nose. Those are all good signs that these vaccines may provide a degree of reduction in transmission. Exactly how much, we don't know.
And there's still no delivery timeline yet for the Johnson & Johnson single-dose vaccine. Procurement Minister Anita Anand notes that 9 nations have bought the J&J vaccine, but only one of them, America, is currently receiving any doses. In Ottawa, Xiaoli Li, City News.